Hello, this is Dr. Grant Cooper at Princeton Spine and Joint Center. In the next 5 minutes, I'm going to tell you everything you'll ever need to know about tennis elbow. First off, what is it? Well, tennis elbow, or lateral epicondylitis, is an inflammation of the extensor tendons, these guys in the forearm, that attach to the bony prominence in the elbow, called the lateral epicondyle. This is easily one of the most common causes of elbow pain. It's usually a very easy diagnosis to make. The person presents with pain along the forearm, usually most severe at or around the insertion of the tendon, right up here by the elbow. Resisted wrist extension reproduces the pain. There shouldn't be any associated numbness or tingling, and reflexes should be normal. The arm and grip strength may feel weak secondary to pain. Interestingly, while tennis players definitely are at risk for getting tennis elbow, and specifically tennis players who play a lot of backhand, and also tennis players with a wrongly sized racket grip are at risk. But most people who get tennis elbow don't play tennis at all. Instead, any repetitive activity that involves repetitive motion of the wrist or arm are at risk. So for example, plumbers, painters, computer users who use the mouse a lot, golfers, gardeners, just to name a few, are all at risk. In tennis elbow, or lateral epicondylitis, repetitive strain on the tendon can lead to inflammation, or it can lead to micro tears in the tendon that then leads to inflammation. Now, inflammation is a protein response that causes pain and sometimes swelling. The best way to think of inflammation is that it's like a fire. And there are two ways of putting out a fire. One is to move away all the fodder, right? You clear away the fire dies down. For tennis elbow, this is primarily with rest, exercises, and bracing. Resting the elbow from the offending activity is important. Tennis elbow is a repetitive stress injury, and if you keep on doing the offending repetitive activity, you don't give it a chance to heal. So rest, at least for a little while, which can mean a few days to a month or more, depending on the severity of the case, is important. The exercises for tennis elbow seek to stretch and strengthen the appropriate muscles in order to take the pressure off of the tendon itself and allow it to heal. For these specific exercises, you can please go and check out our video on tennis elbow exercises. Another approach to move away the fodder and to let the fire die down is with bracing. Now specifically, a tennis elbow counterforce brace, which you can pick up on Amazon or at any medical supply store, is a slim brace that goes around your forearm. It goes around over here. It's the most popular brace for tennis elbow. And what you do is you line the gel patch or the cushion up about 2 centimeters downstream or distal to the site of pain. The idea of this brace is that it redistributes the forces away from the inflamed tendon and spreads the force out to the rest of your forearm. It's a nice idea, and some people with tennis elbow absolutely swear by these braces. Others don't get any relief whatsoever from them at all. So it's certainly not a panacea, but it's something to try, and some people will certainly find it helpful. Another bracing option that's less common but can be quite effective is to wear a neutral wrist brace at night. As we sleep, we tend to sleep with our wrist flexed. They flex forward like this, and this puts a lot of stress on the tendon. It pulls at it at the elbow. So wearing a wrist brace that keeps the wrist in neutral at night takes the pressure off the tendon. And for some people, that can make a big difference in allowing the tendon to rest. Now, the other way to put out a fire is with a fire hose. A great fire hose for tennis elbow, believe it or not, is ice. Applying ice for 15 to 20 minutes every 4 to 6 hours for a couple of days or so can be very beneficial. This is especially helpful to try when the pain first starts. Also, topical NSAIDs like over-the-counter Voltaren gel or Flector patch, or a prescription-strength one like Princeton, basically topical Advil, topical diclofenac in this case, as well as ice. Now, the reason that ice and topical NSAIDs can work so well for tennis elbow is that the NSAID and the cold from the ice diffuse through the skin, and the tendon is very close to the surface of the skin, so the medication in the cold can actually reach the tendon. This is in contrast to problems that are deeper, such as knee osteoarthritis or hip arthritis or spinal stenosis, where the medication isn't going to be able to diffuse deep enough to make a true difference at the level of the problem. So ice and topical NSAIDs are good first-line choices. You can also take oral NSAIDs, although here the problem is that not much of the oral medication will actually get to the inflammation in the tendon. So generally, I prefer topical NSAIDs for this purpose, not to mention that topical NSAIDs are going to have fewer side effects than oral NSAIDs. Injecting steroids under ultrasound guidance into the tendon sheath is another option. Now that said, ultrasound-guided steroid injections for tennis elbow has mixed reviews in the literature, with most studies showing excellent short-term relief, but not all studies show good long-term relief. One thing is certain: if steroids are used to calm down the inflammation, then the tendon needs time to rest and time to strengthen with exercises before returning to sport so as to not further worsen the problem. Also, repeated steroid injections can be problematic because they can weaken the tendon. Most physicians, if they were going to recommend a steroid injection at all, would recommend not having more than 3 steroid injections for the tendon within a year or two, and each one should be spaced out by at least a month. Physical therapy can be very helpful for tennis elbow, not just because of the exercises that the therapist will be able to show you, which are very important, but therapists can also use their passive modalities such as ultrasound and electrical stimulation units, as well as soft tissue manipulation. Tennis elbow that is not improving with good conservative care may be an excellent candidate for PRP, which is platelet-rich plasma, or other regenerative medicine techniques, such as prolotherapy. The main detractor from using something like PRP, PRP specifically is where you aspirate someone's blood, you spin down the platelet growth factors in a centrifuge, and then you inject them back into the pathologic site in order to attempt to stimulate the body to repair itself. But the main limitation is financial cost. As PRP and other regenerative treatments are not proven to work, insurance almost never covers them, and they can be very expensive, ranging from $750 to $3,000 or more, depending on the doctor and the precise treatment being considered. So cost is a good reason to not use it immediately. But from a clinical perspective, it remains an attractive option if you're trying to avoid surgery. Of course, that said, surgery can be performed, particularly when there's a partial tear of the tendon. But of course, it is a measure of last resort, and it's not generally necessary. Still, surgery can be quite effective to debride and repair a torn tendon and should be discussed as one of the treatment options when there's tearing present. I hope you found this video useful. I think we went a little over our time. If you've enjoyed the video and you learned something, please remember to like this video, subscribe to the channel, and tell a friend who might enjoy it, because that's the way that we can spread good health information and achieve good health outcomes together. As always, if you have any questions that you'd like for me to answer in a future video, or if you have any comments, you can reach me at drcooper@princetonsjc.com. Or of course, please feel free to leave a comment in the comment section. Thank you very much.